Okay, there are many specific modalities in the alternative cancer world, such as insulin potentiation therapy, high doses of vitamin C, high doses of other minerals such as selenium, hyperbarics, and on and on and on and on. And you'll often read that, well, I tried this and it didn't work. I've heard that it worked for other people, and then you'll find out this new supplement, and if you get the new supplement, they'll have stories, testimonials from people saying that I took this Eziac tea and that's all I did and it cured my stage 4 cancer. Well, those are rare, very rare situations, and I have personally never seen it occur. The truth is that cancer is a process that the body is going through in order to maintain balance, and its reasons, the reason that it came to be that way is multifactorial. There are many reasons why. So, since the body, if one understands that the body is going through a process known as cancer to maintain balance, then we understand that cancer is not the enemy. But yeah, we don't want those cancer cells there because they are eating up other cells, obstructing vital processes, so we do want to get rid of them. But just getting rid of them is not going to solve the problem. You see, if cancer were just a local situation, a local condition, every woman who had a breast tumor, and we went in, we took it out, we had clean margins, no lymph nodes, well, we should be done. But we're not. A year and a half later, it's in her lungs, in her liver, her adrenal glands, her brain. Okay, that's because it is not a local condition. Cancer is really a systemic condition, which is why right now, if you go to a conventional oncologist and you have a lump in your breast, they'll take out the lump, they'll do a lumpectomy or a mastectomy, then they'll do chemo and radiation because they know that it's not just a local condition. It just happens to be manifesting in the breast or the pancreas or the prostate. So therefore, it only makes sense that what you need to do is to clean the system. Get the system clean so that it no longer needs to produce cancer. And that's what we do here at An Oasis of Healing. You know, it's the fundamental thing that we do, is we teach you how to change your biochemistry so your body's no longer producing it. Because it really doesn't matter how good anyone is at getting rid of cancer if you're still making it. You know, it doesn't matter how good IPT is or high-dose vitamin C if you're still making it. It's kind of like the person who had lung cancer, quit smoking, goes through a treatment, the cancer goes away, and 6 months later starts smoking again. Well, what can you say about the treatment? Can you say the treatment didn't work? You can't say anything about the treatment. All you can say is that we don't know now because it's been confounded because the person is now making more cancer. Okay, so insulin potentiated therapy has been around since 1933. It was discovered by Donato Perez Garcia I in Mexico, and the first condition for which it was used was tertiary syphilis, and it cured it. A second condition was, where there were many, many successes, was poliomyelitis, reversed infantile paralysis. First time that it was used with cancer was in 1943. So it's an old modality for treating cancer. It's not brand new. It's been around. Since then, since the 50s, there's been, no one knows, 100, 200,000 people treated. No one has any idea how many people have been treated with insulin potentiated therapy. But what it really means is this. Cancer cells, when a cell, the last thing that happens to a cell before it's called cancer, it's no longer breast, it's breast cancer. It's no longer pancreas, it's pancreatic cancer. The last thing that happens is it loses the ability to use oxygen. And once that happens, it goes into a default mode of energy production called glycolysis or fermentation. Once it does that, what does that mean? What are the metabolic consequences of that? Well, it means that when that cell needs energy, it's going to grab glucose, which is the universal fuel, and it's going to ferment it. It only makes two little energy packages called ATPs. Because why are we eating? We're eating for energy. So it makes two little energy packages. The healthy cell, on the other hand, takes that molecule of glucose with oxygen, runs it through the mitochondria, and makes 38 ATP. So what we're seeing is that the fermentation process is extremely inefficient at energy production. So therefore, the cancer cell needs 19 times more glucose. Because it needs 19 times more glucose, it upregulates, grows on its surface all these extra insulin receptors, so that if there's any glucose around and insulin around, it'll grab it first and eat first. It's kind of one of cancer's survival mechanisms. So that's great to know. Knowing that that's a survival mechanism, we can exploit that. We can have you come in a fasting state, give you just enough insulin to open up, saturate your cancer cells. They're like little chicks in a nest with their mouths wide open saying, feed me, and you say gladly, and you give 10% of the normal chemo. Why 10%? Because the mouths are wide open, you know it's not going to go elsewhere. Imagine if a protocol called for 100 milligrams of drug X. You gave 100 milligrams of drug X to a person. 5 went to the brain, 5 went to the left kidney, 5 went to the right kidney, 5 went to the heart, 5 went here, 5 went to the bone marrow, and 5 went to the cancer. Well, you've equally distributed the poison. So rather than do that, you take the person, you prime them with a small amount of calculated insulin based on body weight, and you give them not 100 milligrams, but 10 milligrams. Of that, the majority, 50% approximately, goes right into the cancer cell. So you've only got 5 milligrams circulating for the whole body. So the toxicity associated with this is 5% of normal. That's fine, especially if you have a good detox program going on, which is one of the other aspects of what we do here. So it works really good. And we can do it twice a week because it's so relatively non-toxic. I won't say it's non-toxic, it's relatively non-toxic. We can do it twice a week instead of every 3 weeks, the way most oncology protocols go. So we can do it twice a week. So we can be very effective. So in 3 weeks, we've done 6 treatments, and we watch things shrink down very quickly. The problem is this: if the person is still smoking, if the person is still eating certain things that are producing the cancer, if the person is still working in an environment where they're breathing in toxins that are producing the cancer, it's, you're chasing your tail. You're not going to get anywhere. So we have to, what is absolutely required for a particular therapy like IPT to work is that you have to remove all of the other confounding variables. And one of them is stop producing the cancer. So if someone says, if you read on the internet, oh, IPT didn't work, high-dose vitamin C didn't work, well, you don't know if it worked or not. It probably did work because it always works, because it works at a very fundamental biochemical level. So it's not that it didn't work, it's just that there were so many other things contributing to the continued growth of the cancer that it could not prevail. And that's the way we need to look at it. And this is true for high doses of vitamin C. Vitamin C, or ascorbates, are only vitamins to fruit bats, guinea pigs, and certain primates. All other creatures make it. They make ascorbates. Why? Because ascorbates are essential to life. So dogs, cats, elephants, giraffes, raccoons, bass, they all make ascorbates. But for the ones I mentioned, the guinea pigs, the fruit bats, and the certain primates, because it's coming in their diet, nature's very economical. Nature's not going to make something that's already being provided. So it's there. Well, what are ascorbates? What is vitamin C? It's in chemical terms a reducing equivalent, an electron donor. It's an antioxidant. Antioxidant. What's an oxidant? An electron stealer. Okay. Oxidation and antioxidation are the fundamental way that nature works. It's what your immune system does when it encounters a bacteria or a fungus. It begins to oxidize it. When our higher cells that are not cancerous and not primitive, cells of my heart, cells of my skin, when they need energy, they grab glucose, oxygen, bring it up into the mitochondria, and a process known as oxidative phosphorylation produces high energy phosphate bonds, 38 energy packages, okay, instead of 2 energy packages in the fermentation process, okay. So that, again, oxidative phosphorylation. So we're using oxidation. Oxidation is very important, and just like in all of nature, there's the yin and the yang, there's man, woman, there's day and night, up, down, yes, no. If there's an oxidation, there has to be an antioxidation. You can't start a fire to accomplish a goal and not put it out, because you're going to burn the things that you don't want to burn. Anyway, when high doses of vitamin C get into cells, including cancer cells, and they run into copper or iron, they result in the production of hydrogen peroxide. Well, our healthy cells have an enzyme called catalase because they're always seeing that it's an oxidative byproduct. So they quickly turn it into water and oxygen, which is good for them. Cancer cells don't have that catalase. They can't do that, and they're zapped. So here you have the perfect chemotherapeutic agent. Kills the bad guys, good for the good guys. Okay, so someone says, it didn't work. Well, it worked, but, I'm smoking. I got lung cancer, and I'm doing the vitamin C, it's not working. I mean, if you look at it that way, it seems absurd. But most people don't realize that the life they're leading is a life that's contributing to it. They think of cancer as this thing that they caught, instead of as a process that is happening as a result of the way I'm living my life.